Hi and Assalamualaikum to Miss Maya Suliana. My name is Putrina Amraifah and I am the moderator for this group. The topic that we choose is smoking should be banned in Malaysia. Okay, so smoking is primarily practiced as a route of administration for recreational drug use because the combustion of the dried plant leaves vaporizes and delivers active substances into the lungs where they are rapidly absorbed into the bloodstream and reach bodily tissue. In the case of cigarette smoking, these substances are contained in a mixture of aerosols and gases, like electrically active alkaloid nicotine. The vaporization creates heated aerosol and gas into a form that allows inhalation and deep penetration into the lungs, where absorption and into the bloodstream of the active substances occurs. Okay, so why smoking should be banned in Malaysia? Researchers find that smoking bans can reduce the number of heart attacks by as much as 26% per year. Even breathing in low doses of cigarette smoke can increase one's risk of heart attack. Public smoking bans might also help to prevent lung cancer, emphysema disease that develop much more slowly than heart attacks. A nationwide ban on public smoking could prevent as many as 154,000 heart attacks each year. Direct smoking doubles the risk of heart attack, while secondhand smoke increases the risk by 30%. Interestingly, public smoking bans had a stronger effect in reducing heart attacks among women and younger individuals, which may be explained in part because younger people tend to frequent clubs, restaurants, and bars where smoking is a likely part of the social scene. Dr. Mears and Schroeder encourage clinicians to support community smoking bans and other tobacco control measures. United States increasingly institutes policies to protect non-smokers from secondhand smoke. These efforts will yield great public health benefits in the form of reduced disease, disability, and death. Collectively, collectively, the studies involved 24 million people and observation of the effects of the ban range from 2 months to 3 years. Currently, 182 countries have ratified this treaty. So, here for today, I would like to ask Dr. Aisha about her opinion for this topic.
Assalamualaikum and good evening. My name is Aisha Farafisha and I am a doctor from Hospital Kajang Selangor. I'm going to talk about why exactly smoking should be banned in this country from health aspect. There are more than 7,000 chemicals in tobacco smoke, including hundreds of chemicals that are toxic and about 70 that can cause cancer. Other than that, studies have found that 1 out of 2 Malaysian men smoke. Studies also show that 3 out of 10 of adolescent boys aged 12 to 18 smoke. Overall, the 1999 study found nearly 1 in 5 teen smokes. This translates 7 million Malaysian male smokers. According to 2 studies on teens conducted in 1996 and 1999, the numbers of female teen smoking rose from 4.8% to 8%. Studies show that lung cancer is rising at a rate of 17% a year. Smoking can lead to many diseases and not just mild illnesses like cough and asthma, but even chronic diseases like disability and harms nearly every organ of the body as well. For example, smoking can causes cancer, heart disease, stroke, lung diseases, diabetes, and chronic obstructive pulmonary disease, which includes emphysema and chronic bronchitis. Smoking also increases risk of tuberculosis, certain eye diseases, and problems of the immune system. Not to forget the disadvantages of smoking do not only happen to smokers but also to the people around them. The reason I press this statement is because they often forget about the secondhand smoke. So what is a secondhand smoke? Secondhand smoke is smoke from burning tobacco products like cigarettes. Secondhand smoke is also smoke that has been exhaled or breathed out by the person smoking. Um, Inhaling such smoke can also cause commensurate harm to the people around the smoker. As you can see on the diagram, is adverse effects on the secondary smoker. So there is no risk free level of exposure to secondhand smoke. Secondhand smoke can cause numerous health problems in infants and children, including more frequent and severe asthma attacks, respiratory infections, ear infection, and sudden infant death syndrome. Next, some of the health conditions caused by secondhand smoke in adults include coronary heart disease, stroke, lung cancer, and low birth weight for the woman. So based on the statements I say, I strongly agree with the title of this forum, that is smoking should be banned in Malaysia. That is all from me. Thank you for listening.
Alright, Assalamualaikum. My name is Alif Arif bin Azman Shah. I'm a owner of cigarette and vape shop. Okay, for me, I'm disagree with this statement that smoking should be banned in Malaysia. Why? Because as you know, alcohol is still legalized in Malaysia. A lot of accident happen because of drunk driver. Why? And why you at this statement, why you specific ban only cigarette while alcohol is still legalized when a lot of accident happen? Second, government already make a lot of law that when you smoking, we have a specific place to smoke, and we're not disturbing people when we smoking. As you already know, smoking also cannot smoke. Smoking also cannot smoking at the restaurant. I mean, you cannot smoking at the restaurant. So, like I said, we have a lot of law to follow when we smoking, right? So why you should ban Malaysia ban smoking? If the law like the back in the day when 1990s, a lot of smoking can smoking at restaurants, cinema. Then you can ban cigarette because you know at the 90s we can smoke everywhere. But but in the modern day, right now we have a lot of law to follow, so we can follow it for not disturbing people that not smoking. At the last thing, you can see my graph there. I have asking thought of why smokers disagree smoking should be banned. You can see at the graph a lot of question I asked to them. About 70% people agree with my statement. All right, that's all from me. Thank you. Thank you. Yeah.
Okay, so next. Okay. So next, I would like to ask Miss Hidayah about her opinion about this topic.
Good afternoon. Me, myself, is Norhida Abri. I'm the owner of Garfu Place. I strongly agree with your statement about smoking should be banned in our country. Why do I say so? This is because I have also faced a lot of problem with many rude people who don't want to follow the law. According to the Malaysian law, Section 36 Food Act in 1983, customers can smoke in the covered dining area, and they are not allowed to smoke in the food premises up to 3 meters from the food premises. I have also reported some customers who do not. I have I have also reported some customers who do not want to comply with the law, but the authorities have not taken any action. In addition, I have also lost a lot of customers because majority of them are non-smokers, and they feel uncomfortable with the surrounding polluted by the smoke of cigarettes. The they just want to enjoy their food and their time there. So I really hope that the new law can be implemented in Malaysia with a considerable condition and appropriate punishment. This That's all from me. Thank you.
Alright, thank you. Okay, now I introduce myself. I am Denis Kanda, and I am an office worker. Sorry. Okay. First thing, my opinion. I disagree. Why smoke should be banned in Malaysia? Because for me, uh, I'm discovery. Apa? I discovery many many smoke brand have no tar or dangerous chemical inside because some of cigarette have uh, flavor 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 and herbal and good for healthy. For example, for me, uh, I'm smoke a flavor and herbal, and sometimes I smoking vape. I am smoking? Because when I'm working at the break time, I smoke for refreshing. Because when I working, I'm do my job, I feel a little bit stress or heavy stress. And for countdown, I'm smoking for a few minutes and to refreshing my mood. So that's how can increase my job quality to to my my work lah. So for example, if I not count down myself, I can continue my job. Yeah, that's all for me. Thank you.
Okay, thank you. So before we end this session, I would like to ask a few questions for you. So the first question is for Dr. Aisha. Is there any solution, and is it possible to treat those who actively smoke?
Yes, it is actually
Actually
possible
possible
because
because
clinics and
clinics and
hospitals
hospitals
exist to
exist to
provide
provide
healthcare
healthcare
and
and
therefore
therefore
welcome
welcome
anyone
anyone
wanting to
wanting to
seek
seek
help
help
for their
for their
health and
health and
well-being.
well-being.
The same
The same
applies to
applies to
smoking
smoking
cessation
cessation
clinics.
clinics.
If you
If you
are
are
looking for
looking for
a
a
helping
helping
hand to
hand to
quit your
quit your
smoking habit,
habit,
you need
you
to
need to
locate a
locate a
smoking
smoking
cessation
cessation
clinic
clinic
in
in
your
your
area
area
and walk
and walk
straight
straight
in.
in.
You might
You might
have
have
to
to
arrange
arrange
appointment and
appointment
so
and so
on, but
on,
you
but you
will get
will get
help.
help.
Moreover,
Moreover,
public
public
smoking
smoking
cessation
cessation
clinics
clinics
will
will
only
only
cost you
cost you
RM1 to
RM1 to
RM5
RM5
ringgit
ringgit
per
per
consultation,
consultation.
but you
But
might
you
be
might be
paying more
paying
if
more
you
if
are
you are
going to
going to
private
private
centers.
centers.
Okay,
Okay,
thank
thank
you.
you.
So
So
for
for
the
the
second
second
question, I
question,
would
I
like
would
to
like to
ask
ask
Miss
Miss
Hidayah.
Hidayah,
Is it
is it
appropriate for
appropriate
the
for the
government to
government to
create a
create a
new
new
law to
law to
ban
ban
smoking and
smoking and
impose
impose
appropriate
appropriate
punishment
punishment
so that
so
the
that the
people do
people do
not
not
dare to
dare to
break the
break the
rules
rules
that
that
have been
have been
set?
set?
In my opinion, I totally agree with the idea of creating a new law by the government to ban smoking and impose appropriate punishment. Why do I say so? This is because one can learn from other people's mistakes. Hence, more people will get awareness about smoking, which it can harm people, not only ourselves but also others. For example, cigarettes contain tar, carbon monoxide, nicotine, and many more harmful substances that can cause harm and air pollution. Thus, we need to make sure that this issue needs to be reduced to avoid any bad things that can destroy something that is valuable to us, such as our lungs and liver. Therefore, I believe that it is appropriate to create a new law by the government to ban smoking in Malaysia. Thank you.
Thank you,
Thank
Miss
you, Miss
Hidayah.
Hidayah.
So we
So
have
we
two
have
more
two more
questions
questions
left.
left.
I would
I would
like to
like to
ask
ask
Mr.
Mr.
Ali for
Ali
the
for
third
the third
question.
question.
How do you
How do you
feel
feel
about your
about your
smoking?
smoking?
How do I
How do I
feel?
feel?
Like
Like
Danny
Danny
said, when
said,
he
when
is
he is
stressed,
stressed,
he was
he was
smoking,
smoking,
right?
right?
To
To
release his
release his
tension.
tension.
Yeah,
Yeah,
same goes
same
to
goes to
me.
me.
I don't
I don't
know
know
others
other
people
people
feels
feels
about
about
them, but
them,
for
but for
me,
me,
when I'm smoking, I want to release my stress. It also will calm me down when I'm feeling anxiety. So smoking helps me to release my stress and calm me down. So that's why it's so hard for me to stop it. That's all for me. That's how I feel when I'm smoking. Okay, thank you.
Okay, thank you, Mr. Alif. So for the last question, I would like to ask Mr. Danish, what do you think about quitting smoking?
What I feel, I feel if I quit smoking, I can do my job properly because, like I said previously, I need to refreshing with smoking to increase my quality of job. So if I quit, so I know if I quit, my job quality is decreased a lot. For example, I'm stressed and it's a break time. I'm not smoking and I do whatever, but it still make me feel stressed to continue work. So I know I can do my work properly. So if I smoke, I refreshing and calm down. So I know I can continue my job. So that's why I feel if I quit smoke.
Okay, thank you, Mr. Danish. So we have no more questions. Thank you for lending me your ears and cooperate with me during this presentation. That's all from us, and thank you. Assalamualaikum.